Hi, this is Dr. Gharagozlou. Today we are going to talk about individual sleep medications and groups of sleep medication. This is the part 2, section A of our discussion about sleep meds. In this talk we will cover two groups, benzodiazepines and benzodiazepine receptor agonist. Those are very important tools that we have to control insomnia by medication if we choose to. And I would say half of the prescriptions that I write for sleep is among one of these groups. So benzodiazepines attach to a receptor called GABA-A. Some of you might have heard gabapentin. It's coming from this group of receptor name, and it's named after this group of receptors. These are membrane proteins that sit in the synapses. They are very, very common in neurologic system, including brain and nerves. They are inhibitory, so when we activate them, the next cell is gonna be less activated. So they inhibit the firing of next cells. So when somehow a molecule comes and attach this portion, we call them ligand, they open a chloride channel and they generate a message. As a consequence of that, a G protein will be activated and a second messenger protein will be activated, and down the stream it does something in the cell that it causes less likelihood of the next cell firing. So let's say we activate this with a drug or with our own body mechanisms. What's going to happen is that because of this activation, the cell that this GABA receptor belongs to is not going to fire. When that cell is not firing, multiple things happen in our nervous system. One, we get sedation and sleepiness. Two, we get less anxiety. Three, we get muscle relaxation. And also sometimes in some parts of nervous system we get anti-seizure effect. This is the same receptor that alcohol binds to, and also a large group of medication called benzodiazepine will attach to them. Additionally, newer some designer drugs that we call them Z drugs or benzodiazepine receptor agonist attached to the same molecule. There are differences between these Z drugs and traditional benzodiazepines that we will talk later. So benzodiazepines include many medications like diazepam, lorazepam, and for example temazepam, alprazolam or Xanax, alprazolam. These medications are very effective, very strong medications that are used for anxiety. Obviously, there are many other benzodiazepines that I didn't write every single one here. They're very effective and a strong medication for anxiety. They are second and third line of therapy. They are normally less used for the purpose of sleep, or sometimes never used in some practices for the purpose of sleep. unless the patient is very complicated. And they use, they do cause tolerance, so the medication loses its effect as we take it and we need more medication. They do cause dependency. That's when you need the medicine, and if it doesn't get to you, you might behave in an inappropriate way. That is addiction. Also, they cause withdrawal. That means if you stop the medication, you immediately become sick. These medications, as I said, we try to not use them that often because of these issues, and also because of current social situation and many overdose and polysubstance abuse that is rampant in our communities. As another solution, we found the Z drugs. The Z drugs are also GABA-A receptor agonists, but they have a lot less problem with tolerance, dependency, and withdrawal. They do cause sedation, and that's why they are used for sleep. The most common medications that are used in America are zolpidem, zaleplon, and the third drug that we normally use in America is called esopiclone or Lunesta. They have different characteristics that we're going to talk about them pretty soon. If you remember from the previous discussion on the previous video, we would like a medicine that gets in fast, stay in till the early morning and gets out fast. So these drugs have different characters. Also on medication zolpidem, the manufacturers became pretty creative. We have different formats of it that act differently. For example, we have a sublingual format that is absorbed much faster and can be taken in the middle of the night even on low doses. And we have a delayed release or CR form of it that has a biphasic release format and stays in the system most of the night and give you a early morning effect. However, doesn't get to the late morning due to its metabolism. Zolpidem CR is one of my most favorite medications for general use for insomnia patient. I also use the zaleplon quite often to give an effect of quick sleep initiation. However, the patient is on their own to continue their sleep by themselves. Esopiclone is almost like zolpidem. It kicks in fast and stays in the system. I would like to talk about the side effects. The most common side effects are obviously drowsiness. These are medications that cause drowsiness. So sometimes it causes too much drowsiness that we don't like it. Dizziness and imbalance are other two problems that we sometimes see. And memory impairment is a major issue with this group of medication. So if the memory does not work right in the night, you don't have access to a lot of learned skills. You might do some things wrong, or you might do some things that have problem with morality. For example, maybe you resort to violence, or you get the keys and go in the highway when you are not quite awake. So this is the major problem that we see with these medications, even though the risk of these kind of side effects is not quite high. We mentioned here, we would like to look at these medications based on how rapidly they start working and if they have a short effect or long effect. We would like to group benzodiazepine and benzoreceptor agonist medication based on their initiation of action time. So if they kick in rapidly or it takes time for them to kick in, based on how long they stay in the system and how long they protect the patient. The hindsight of it is that they can cause daytime effect later on, and also based on how much addiction liability they have. So the first one is alprazolam. Alprazolam is very rapid acting, and it has a short efficacy time. It's a short acting medicine, and it gets out of the system soon. And it does have a high addiction liability. The next medicine that we talk about is diazepam. Diazepam is rapid acting, so it gets in fast, but it's a long acting medication. It still has a significant risk of dependency, but the addiction liability, even though it's there, it's relatively, in my personal experience, less than alprazolam. Other medication that I like to discuss is lorazepam. Lorazepam has an intermediate kick-in time, so it's not as fast as acting as the other two. However, it stays in the system also intermediately, so sometimes for sleep this medication is used in a correctly selected patient. It also does have dependency issues. The next medication is clonazepam. Clonazepam is a short-acting medication with long effect. Among this group of benzodiazepine, it has the least amount of dependency and addiction liability, but it still does. Then we will discuss the 3 Z drugs that are used in America. Zolpidem is a rapid-acting medicine with short efficacy time. As I said, the CR format is a dual release format, so some part of the medication is released fast and some part of the medication get digested slower. So has a biphasic initiation, so has a longer effect time. Zaleplon is very rapid acting and also very short acting, so you can take it in the middle of the night and have no daytime effect, or sometimes if you have problem only with initiation of sleep, Zaleplon is a good option. The next one is opiclone. Has intermediate kick-in time, so it's not as rapid as Zolpidem or Zaleplon, but it stays in the system for intermediate amount of time. So if I want to use something for sleep maintenance with low addiction liability, my first choice in appropriate patient would be ambient CR. Here I would like to state that there are 3 or 4 type of patient that you want to avoid all of these medications. Patients who have advanced age. Aging is a problem. You don't want to give this medication to old age. You don't want to give these medications to somebody who has cognitive issues like dementia or mild cognitive impairment, because they cause more. Also, if there is a issue with substance use disorder, you want to avoid all benzodiazepine receptor agonists because they open the gateway for further substance use. This will conclude our part 2A discussion, which are the most common used medications for insomnia. In the next part, I discuss medications that we use for people that we don't want to use benzodiazepine receptor agonists, and or people who have comorbid issues like psychiatric or medical issues that need other type of medication as a better choice. And there are a lot of them, and we'll discuss in a separate discussion, separate video. Thank you very much for your attention, and I see you next week. As we say in the Healthy Sleep Care, heal your night, live your life. Thanks, bye.